Welcome to Mental Health Magazine, Understanding Major Depressive Disorder with Peripartum Onset. Motherhood is often described as one of the happiest times in someone's life, but for many people, it can also come with unexpected challenges. I chose this topic to help raise awareness and reduce the stigma surrounding this condition. This magazine is designed to help people understand what peripartum depression looks like, how it affects individuals and families, and most importantly, how people can get support. Experiencing this condition does not reflect someone's love or ability as a parent. Peripartum depression is a form of major depressive disorder that occurs during pregnancy or shortly after childbirth. According to the DSM-5-TR, it is not considered a separate disorder, but rather a specifier used when depressive symptoms begin during pregnancy or within 4 weeks after delivery. Although the DSM specifies 4 weeks postpartum, research does show that symptoms can occur within the first year after delivery. This is why it's important to recognize that peripartum depression is more than what people typically think of as postpartum depression. Symptoms include a depressed mood nearly every day, loss of interest in activities, changes in appetite or weight, and sleep disturbances beyond what's expected with a newborn. Many people also experience fatigue, feelings of guilt or worthlessness, difficulty concentrating, and in more severe cases, thoughts of death or suicide. To be diagnosed, a person must have at least 5 of these symptoms lasting 2 weeks or more. One of the symptoms must be depressed mood or loss of interest, and it must significantly impact daily functioning. It's important to understand the difference between baby blues and peripartum depression. Baby blues are very common, affecting up to 70% of individuals, and usually last only a few days to 2 weeks with mild symptoms. Peripartum depression, on the other hand, involves more severe symptoms that last longer and interfere with daily life. Research also shows that about 27% of people who experience baby blues may go on to develop depression, which is why early awareness is incredibly important. Perinatal depression affects about 1 in 7 people, with a global estimate ranging from 6.5 to 20%. About 9% experience depression during pregnancy, and around 7% experience it within the first year after giving birth. However, many cases go undiagnosed due to stigma, lack of awareness, or fear of judgment. There are several factors that can increase risk. Biological factors include hormonal changes, genetics, and sleep deprivation. Psychological factors include a history of depression or anxiety, premenstrual syndrome, or past trauma. Social factors like lack of support or domestic abuse also play a major role. And obstetric factors include high-risk pregnancies or traumatic birth experiences, including unplanned cesarean section. Peripartum depression doesn't just affect one person, it affects the entire family. For mothers, it can impact daily functioning, caregiving, and emotional connection with their baby. Feelings of guilt or worthlessness are common with this condition and increase the risk of suicide. For babies, it can interfere with bonding and may affect emotional and cognitive development over time. Children of mothers with untreated depression are more likely to experience delays in cognitive development as well as emotional and behavioral difficulties. It can also cause stress within relationships and increase the risk of depression in partners. This is why early treatment is important, not just for the individual, but for the family system. Peripartum depression is very treatable. Treatment usually includes therapy, support systems, and sometimes medication. 2 effective therapy approaches are cognitive behavioral therapy, or CBT, or interpersonal therapy, or IPT. CBT focuses on negative thought patterns and building coping skills, while IPT focuses on improving relationships and life transitions. Antidepressants, especially SSRIs like sertraline, commonly known as Zoloft, are also commonly used and are generally considered safe during breastfeeding. To reduce the risk of returning symptoms, Treatment is usually recommended for 6 to 12 months after improvement is seen. There are many harmful myths about peripartum depression. One myth is that it means you won't bond with your baby, but with treatment, strong bonds can absolutely develop. Another myth is that people should just push through it, but in reality, many people need support and treatment to recover. It's also not limited to after birth. It can begin during pregnancy. And most importantly, it is not a reflection of being a bad parent. Experiencing peripartum depression is not a reflection of personal strength, weakness, or parenting ability. It's important to know the myths from facts, as up to 50% of cases remain undiagnosed due to the stigma surrounding this condition. Major depressive disorder with peripartum onset is a treatable condition that can affect individuals during pregnancy and after childbirth. It is not a reflection of personal weakness or parenting ability. With early recognition, education, access to treatment, and support, individuals can recover. Reducing stigma and raising more awareness can help establish a system where parents can feel supported and understood. If you or someone you know needs support, help is available. The National Maternal Mental Health Hotline and the 988 Suicide and Crisis Lifeline both offer free, confidential support 24/7. For local resources and information, visit the Texas Health and Human Services website. You are not alone, and reaching out can make a difference.